usually the thing is, if the patient come at that point to lose everything, that also means probably the patient has like diabetes or unfortunately lack of oral hygiene. He or she cannot maintain oral hygiene perfectly. Usually, at some point, we have to remove everything. Usually, those patients are not like, I'm missing only one tooth, replace it, one implant or a bridge. This is something else. This is like again and again. They have like paradontosis, some unfortunate genetical disease. So we have to remove everything. At that point, usually we have to do full mouth operation, not only one jaw. And the main reason is paradontosis. Paradontosis is, let me find the picture. Oh, this is a very dramatic one. Can you able to spot these blackish areas?
Yeah.
This means the body is trying to get rid of the tooth because the body isn't like anything in the body. It's not like the hair. It's not like the nails. It is like the eye. It's not like the nose. The mouth is open to everything, and the bacteria can able to find food for itself. You have to eat. The bacteria nutrate itself. It is funny, I know. Whatever you eat, and the bacteria settle around the tooth, and the body says, this is something cause bacteria and infection for me. Let's get rid of it. And the bone resorption starts. But it takes decades to get rid of the tooth.
Yeah, so let me ask you something, because is that mean that in paradontosis we can say in a very simple language that the body is identifying the tooth as a threat because of the bacteria which are around?
Unfortunately, yes. Of course, there is a treatment for that. Parodontologist usually says we can save the tooth. Of course, we can save the tooth. It is like dietitian says you can lose weight. Of course, someone can lose
you
weight.
can. Look, this is a theoretical thing. You can do everything.
Exactly.
You can be healed from any disease.
But you have to cooperate with your doctor, your physician. We can treat paradontosis if it is not irreversible. Reversible paradontosis obviously means reversible, but the patient supposed not to smoke cigarettes. The patient supposed not to be diabetes, even not pre-diabetic. The patient's oral hygiene is supposed to be perfect, but no one. Even for me, it's a burden. Let me say this. Every single night, brushing your teeth using interdental brush or floss is a burden. So at least between 2 days, you have to floss every single spot, which is taking like at least 5 minutes, even for a dentist, even for a manipulative hands. It is not easy to reach your molar teeth.
Who is doing that?
No one. That's why this is too much.
Just a theory. Yeah, I know. That's some kind of perfection we are going to, but
Exactly.
as you said, no one is perfect probably. So
definitely, because of that reality, we have to do All-on-4, All-on-6. Normally, again and again, if you show this X-ray to a parodontologist, they start, okay, we will do deep cleaning for this area. We will motivate the patient for cleaning, maintenance of oral hygiene. But where was this patient all this time? He or she couldn't bite anything. It's always bleeding. There is bad smell. There is pus coming out all the time. They are not, sorry to say this, usually they are not cooperative. If the patient has come at this point, this means they are not going to cooperate with you. And it also means if you keep any of these teeth inside the mouth, the bacteria will continue living there. Good for us, when we remove everything inside the mouth, the bacteria cannot find any spot because there is no tooth. There is a fortunate thing about full implantation for paradontosis patients. When we remove everything, that specific bacteria, Actinomyces, cannot find any spot to settle inside the mouth. So it is better for this patient to remove everything.
So bacteria are moving out with the teeth.
Yeah, because there is no place to settle.
Okay, that's great. So we can summarize this block like with the very good information for people with the paradontosis. That if they didn't succeed during the time with treatment, they can have this solution All-on-4 and All-on-6 and just fix the dentures and the problem is solved, right?
Exactly. And when we do this procedure to any of these patients, The common thing before the operation is, doctor, I'm scared. I tell them, I sympathize, I understand, because you do only once. A patient can only remove everything at once because you have only one time to get rid of everything, because they will not grow themselves again and again. So this operation can be done only once in life, obviously, but afterwards, always I hear the same thing. If I knew this operation was that easy, I would have done this earlier. Every single day I hear this before and after, every single day, believe me, like sometimes 10 patients, sometimes 15 patients.
I believe you, because all of the patients who had the treatment here, they were saying like they didn't expect that it was like this. As I also said from my experience, that you will not notice even that you had implantation, and they were like, no, you know, I'm a bit scared, and afterwards they were confirming what you are saying.
It's pretty understandable though. If I was in that area, I would scare, by the way. If somebody said, we will remove all of your teeth, I say, what?
Yeah, that's why everyone has to get his own experience, which of course we are encouraging here, to come to Turkey to do All-on-4, All-on-6 with this special doctor and with this special clinic, because it's worth it. And yeah, definitely Turkey is welcoming you. Okay.